and welcome back to my channel. My name is Aisha, aka Nurse Aisha. I'm a registered nurse here to spread awareness on preventative health and lifestyle choices for women. That is my focus so you can lead a healthier and more informed life. Welcome to my platform. All right, ladies, because I advocate for preventative health and always talk about what you should do before you get sick, I thought that I would talk to you about my personal health journey and what I've done throughout the years to get through the hurdles with my own personal health. Let's get into it. So I have a total of 4 diagnoses. So basically, I have different diseases that I live with, that I manage, that I have treatment for, and we're gonna talk about these diagnoses. So my first diagnosis is a very common condition or disease. It's anemia. So I have had anemia for quite a long time. I think it was around my 20s when I got diagnosed with anemia. My anemia is basically iron deficiency. So if you know anything about anemia, there's so many types of anemia. There's about 11, I believe. And I have the most common type of anemia, which is iron deficiency. So I do remember around the time that I got this diagnosis, and it's very, very common among young women in their fertile years. So this is what happened. This is my story. So what happened is I was young, I was sexually active, and I wanted to get some contraceptives. So I went to my midwife and I did what you shouldn't do. I asked for something that I thought, that I knew worked for my friends. A few of my friends in my friend circle had this contraceptive method that they thought was very, very convenient. You didn't have to take any pill every day. It was just, underneath your skin. So I thought that will work for me. You don't have to do anything. You don't have to insert anything. You don't have to swallow anything. So I asked for that specifically. And so my midwife said, all right, let's do this. And she inserted this coil underneath my skin, and it did not work for me. But the sad story is that I didn't realize this until it was so late. So what happened is my body didn't react well to this. So I bled. I basically lost a lot of blood. And I did something that I talk about very much on this channel. I normalized this bleeding. I thought, it's normal. But something happened and I kind of thought, this is not normal. So I kept on bleeding constantly for a good 3 weeks. But as you know, ladies, we normalize this. We sort of think, maybe this is, something that will just disappear. But it didn't. And what happened is I got tired. I got the most common symptom that you get from iron deficiency and blood loss, heavy blood loss. I got so tired, fatigue. So what happened is, I believe I stopped bleeding maybe somewhere a week. There was a week in between, which I thought was my period. And I still felt tired, and I still felt it was normal that I would start bleeding again. Because I do believe they told me something about extra bleeding, but I didn't really think it was going to go on for this long. So what happened is I actually realized it myself that something was wrong. So I went back to my midwife and explained. I actually didn't go back. I called her and I asked, is this normal? And she said something about, this is a reaction, this could be normal, it might, disappear. But when I called the second time, I wasn't asking questions. I was demanding. I told her, I need to remove this. This is not working for me. But what she told me, unfortunately, was that we don't do this. We don't remove them per emergency. Like, it's not life-threatening. That's what she told me. So I had to wait. I had to wait to remove this thing in my body. But I did. Eventually, I got an appointment and this was removed from my body. And funny thing is that she said this wasn't a hit. She said that a lot of people had complications with this method of contraceptives. And I was young. I heard what she said, but I couldn't do much about it. So I went on with my life, but I kept on having the symptoms of fatigue. I was so tired. I would sleep anywhere. I would sleep on the bus. I would sleep when I get home. I would doze off at work. So, and I had something where I had blurred vision. So I thought maybe it was my sight. I actually went to an optician to check my sight. So sad, such a sad story. But my optician said there was nothing wrong with my sight. And eventually I went to my general practitioner, who immediately, a few hours after my test had come in, called me and told me, you have severe iron deficiency. I'm basically going to prescribe you medication for this. So she did, and I started taking medication. So when it comes to treatment, I will get back to that, because when it comes to anemia, there's so many types of treatments, and there are other methods that are not maybe pharmaceutical methods to treat your anemia. And I guess for my part, my body, I had to come up and get the best treatment for my body. So if you have anemia, you know this. There's so many methods, and some of them are not suitable for many of us. So we'll get back to the treatment part. All right, so that was my first diagnosis. My second diagnosis was in 2013, and I believe the condition is called pleomorphic adenoma. So what happened is I went to my general practitioner for something else. I believe I went for some type of condition or symptom that I had. And then while sitting there, I mentioned that I had this swelling on my throat, around my throat area, on the left side, I believe. Yeah. So she quickly picked up on that, came over to me and started palpating my throat. And initially I thought, I had a cold coming up, or I had like cold symptoms, but I knew that this swelling had been there for a while, and I really kind of ignored it, which you shouldn't do. You should not ignore your symptoms, and you should not ignore swellings. So she picked up on that very quickly and told me we should prioritize this. So she sent me off for a biopsy. And shortly after that, it came out that I had benign swelling, which is basically my cells that produce saliva had swollen up around here, and that needed to be removed, because as you all know, with swellings, they could be benign, but they could cause problems along the way. So she wanted me to remove this. And in 2013, I had my first surgery, removing that swelling on my throat. So regarding the surgery, it went well and I recovered very well. And you can't really see the scar because she cut right around my very natural lines around my neck, which, we talked about before the surgery. So for my third diagnosis, this diagnosis is something that I live with every day, that I will live with probably for the rest of my life, and also many other women, especially women of color, live with. and that is fibroids. Now, with my fibroids story, we are going to have a whole video for fibroids and the epidemic with fibroids, especially among Black and brown women. So when it comes to fibroids, my story and treatment is really long, but I was diagnosed with fibroids in 2017, I believe. And this is after a long period of symptoms that I myself did not understand. So the first time I went to my general practitioner was because I was basically passing urine very frequently. I went to the toilet so frequently, I kind of thought something was wrong with my bladder, actually, because I remember I was also working at the hospital at this point, and I was afraid of maybe some type of cancer in my bladder. That is what I was afraid for. So I went and asked my general practitioner if this was normal. What happened is she picked up on the fact that I was urinating a lot, and she wanted to document that. So she sent me home with a document where I should write every time that I go to the toilet. That didn't help much. And then she sent me for an ultrasound for around my urethra, basically. And that was the only fear that she had. Oh, well, that's all we talked about. My bladder, basically. We didn't talk about my uterus, which is quite weird, being the fact that I am a young woman at that point and there's no other question asked about my bladder and nothing about my reproductive organs as a young female. So she sent me off for this ultrasound, and I remember going for this ultrasound, and the person taking the ultrasound didn't have any other, what should I say? The referral was never about my reproductive organs, so nothing was seen in this ultrasound. So the process of actually getting my diagnosis with fibroids was prolonged. And this is just a testimony to show you that you should be ahead. You should be on top of your health, to talk to your doctor about your symptoms, your family history, anything that has to do that can help the doctors get to the final diagnosis. I didn't have any information about fibroids. I didn't know anything about anything else, PCOS or endometriosis or anything like that. I actually didn't ask anything myself about my reproductive health. Instead, we only talked about my bladder issue or my urinating issues. Little did I know that this was connected to my uterus. So fast forward a few years later, I went to see a gynecologist because I started at this point getting fevers. Every time I would come close to getting my period, I would get fever symptoms. I would just get not really pain, but I felt like a pulsating sensation around my ovaries. So that is what I talked to her about. And she sent me for another ultrasound. So when I went to my gynecologist and talked about my symptoms, earlier symptoms, and also the symptoms that I was experiencing at that moment, to the point where I booked an appointment with her, she decided to do an ultrasound in the room with the equipment that she had right there. And with the equipment that she had, she could not see my ovaries because there was so much fibroid tissue in my uterus that they were blocking my ovaries, basically. And she said, I cannot see anything. You have so much fibroids, so we need to send you off for a specific ultrasound, like two specialists, basically. And I was kind of not surprised, I guess, and also relieved to hear that there was something. I was experiencing something, even though I didn't know what it was. So with that, I went home and started doing research on fibroids and what it was. Of course, this diagnosis was not fun for me. I didn't know anything about fibroids, which is really sad. I kind of felt disappointed, I guess, in myself. And I also was disappointed in myself as a nurse, as a career woman that had access to this information, I guess. So I read through a lot of material that I had access to, and I didn't only read about the disease itself, I also read about the treatment. And at some point, even before everything was said and done, I had decided for myself, especially because of the symptoms that I had, what type of treatment that I wanted to get done. So when I went back to my gynecologist and everything was on paper, how much tissue, how much it was blocking, how much growth there was in my uterus, she had a treatment plan and I had a treatment plan. Basically, I had made up my mind what I wanted to do. And this is also something that you should always talk to your treating doctor, what you believe is good for you, and then you can have that conversation back and forth and come to a conclusion, a decision together. She had decided that I should try out some new treatment. It was so new to the market and they really didn't know the effects it could have on patients. I do not recommend you to say no to treatment before you do the research yourself. You need to do research and also just talk to the doctor why, and let it be realistic why you're saying no to treatment. So when I said no to this medical treatment, it was because of my background and because of what I had, the research that I had done, and knowing my body also with the reaction of different treatments that I had earlier on. So I said no, very respectful, and I chose surgery, which I believe was the best option for me. So, and the reason why I'm saying that you should do your research, because shortly after this, when I did go back to my gynecologist after my surgery, she actually shared with me that this medication was taken off the market because it wasn't working the way that they thought it would work. So this spared me the pain and the weight and the worrying that comes with the weight, not knowing if this medication might work or not. So that is my fibroid story for now. We will definitely get back to my fibroid story with an expert, because I do want to have this conversation again, specifically for fibroids. All right, so my fourth and last diagnosis is hypertension. For those of you that have been with me for a while, you know that I have been diagnosed with hypertension, which is basically high blood pressure. And I have been medicating since 2020 or 21, something around there. And actually maybe earlier, 2019 perhaps. So what happened is with my hypertension diagnosis is that my midwife, basically, I feel like I'm always at the gynecologist's office or the midwife's office, but I should, because I'm a woman, I'm a female, and I'm always checking up with my reproductive health, basically. So this time around, I went to my midwife for something else. I believe maybe it was around the contraceptives again. Before she put me on this treatment, she took my blood pressure, which was sky high. And I refused to believe this at first. I was like, no. Do that again. Maybe I'm just stressed. And we waited a few minutes and she took my blood pressure again, and it was so high. I was in shock myself. So we halted for whatever that we were doing, and I went back and booked an appointment with my general practitioner, and we went through the whole method and the whole going to diagnosis, from symptom to diagnosis, basically the whole program. And I went home with 24-hour measurement for my blood pressure. I took my blood pressure every now and then. I got myself a blood pressure measurer at home myself and measure my blood pressure every now and then. And all the results just showed that I had high blood pressure. So when it comes to high blood pressure, and the dangers of high blood pressure is that you never really, most of the time, get any symptoms whatsoever. And this is why this condition and this disease is called the silent killer, because you don't really get, there's very, very few people that actually get the symptoms with headaches or anything like that. And most of us don't really get the symptoms, the severe symptoms. And when you actually do, you've had the symptoms for so long that now the body cannot really handle this. So yeah, so I got this diagnosis, and me and my doctor decided on treatment. I was recommended to lose a few pounds or kilograms. And because I was around my normal weight, that was really hard. I did increase my physical activity. I went for more walks, but remember, this wasn't working, and I was getting worried. I was getting worried with this high blood pressure in my body constantly, and with the work that I do, knowing the dangers of constant or prolonged hypertension, I really was eager to get treatment. So obviously we started with something that was a normal dose maybe for a young lady. But as we all know, these medications are not really designed for young women, I guess. So we had to try out a few before we actually landed on the one that I take today on a daily basis. So my hypertension is chronic, basically, like every other hypertension most of the times. And I will have to take medication for my hypertension for the rest of my life. And I'm okay with that because it's a life-saving treatment that will save me a lot of complications, basically. I accept this, I have the awareness, I have the privilege to get this medication, so I take it religiously every day. All right then, so that was my health journey. Now I want to know about your health journey. What are the symptoms and the diseases that you are living with, and how are you treating this? All right, ladies. So what I want to emphasize on, number one, is that it's really, really important that you get a diagnosis, that you get an evaluation with your general practitioner. Talk to your doctor about your symptoms. Tell it all. Talk about your family history, what you might be suffering from or your parents have had before. All right, so what I want to send you with in this message is that it's really important to get a diagnosis. Please do not self-diagnose or self-medicate. Instead, go to a professional, get the diagnosis, and talk about all the symptoms that you're having. Talk about your family history. Talk about how long you've had these symptoms. And also, please do not suffer in silence, and do not normalize whatever that you're going through. Secondly, treatment. It's very important that you get treatment for whatever symptoms that you might be having. Treatment saves life. There are different types of treatments depending on what symptoms and what diagnosis that you might get. The last point that I want to mention is follow-up. Make sure that you always go for a follow-up on your health. Whatever that you are medicating with, whatever that you've been diagnosed with, it's always important to go back to your doctor and get a follow-up. So usually when it comes to chronic diseases, they're usually followed up once a year or more often, depending on what status you are in at that point. When you go back to your doctor for your follow-up, you have a chance to talk about any type of complications that you might have got with treatment, and they also make sure to take blood samples to see if whatever treatment you're on is working, because our bodies are constantly changing and they might not be reacting to the treatment that we had 2 years ago. We might want to increase the dosage or maybe decrease the dosage, depending on the kind of status that you're in. Especially for us women that are always changing, hormonal changes or weight changes or anything like that, you definitely need to go back for this follow-up to make sure that you have the correct treatment at that moment. All right, ladies, we've come to the end of my health journey. I want you to share with me your health journey. What are the hurdles that you're going through regarding your health? What have you experienced? What is your experience with your doctors? Do you have treatment for the symptoms that you have right now? Please let me know in the comment section below, and also ask any questions that you might want to ask me about my personal health journey, and I'll make sure to answer that. Thank you so much for watching, and I'll see you in my next video.